What's going on, everyone? Happy Thursday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Thursday edition of the Pandemic Update for Thursday, June 6th, 2024. If you're new to my channel, this is where we do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. Let's face it, there's a lot of viruses out there, and it seems like each and every day we are learning something new about these viruses. Today we're going to learn something new about H5N1. Who knows what tomorrow holds? As you know, it's been a very busy time period lately for these viruses. We have several news stories to talk about today, so if you're new to the channel, want to stay informed with what's going on with all these viruses, subscribe down below. It's the best way to do it, because really, if you watch the news, you see maybe a 30-second clip on something about one of these viruses, and that's it. They don't go into depth. Here we spend 15 to 20 minutes each day. So subscribe down below, give this a thumbs up, hit that notification bell, share this with anyone you know. That's the best way to help my channel grow and to help keep more people informed. And of course, leave your comments down below. Alright, starting off today, dozens of dairy cows infected with H5N1 bird flu have died or were slaughtered because they failed to recover. This is the first time deaths have been reported in cows, according to Reuters, which found deaths in at least 5 states. BNO News also goes on to say it's currently unclear how many cows may have died. Symptoms include reduced milk production, digestive issues, fever, and diminished appetite. Some of them suffered secondary infections after bird flu weakened their immune systems. At a farm in Michigan, about 10% of the 200 infected cows were killed because they failed to recover. Deaths have also been reported in South Dakota, Texas, Ohio, and Colorado. Let's back that up for a second. Some of them suffered secondary infections after bird flu weakened their immune systems. We all know another virus, which is the reason why this channel was started, that causes that to happen, and that is COVID. So this bird flu, H5N1, it is starting to get smart, and it has learned how to reinfect cows already. So it's getting smarter. Hopefully it eventually does not go human to human. Moving on, there's more. New, Minnesota reports its first outbreak of H5N1 bird flu in dairy cows. It is now the 11th state. A few cows became sick over the weekend, and by the next day, more than 40 cows were showing signs of fever. So number one, it's good at reinfecting. Number two, it can spread like a wildfire rapidly. A few cows to 40 cows, real quick like that, yeah, that is not a good thing to see. And then, of course, we went to number 11, but we skipped number 10. Yes, last night number 10 was reported. New, Iowa reports its first outbreak of H5N1 bird flu in dairy cows. The 10th U.S. state, and as we know now, there's 11. So this is continuing to rapidly spread, and of course, we learned that it can reinfect, so we'll skip over this. Moving over to South Africa now. They are actually bringing back masks in a Cape Town school. Why are they reinstituting face masks? Not because of COVID, but because of the number of RSV cases which are going up. So again, they are bringing masking back in a school in South Africa. Alrighty, moving on to this now. Not going to spend a lot of time on this, but we all hear about in the summertime. A child gets left in a hot car. Someone forgets about the child, or maybe they just say, oh, I'm just running to the store, I'll come right back. As we all know, it can get very hot really quick in a car in the summertime, especially with the sun shining on it, or if it's a really hot day. And then there have been some experiments done where someone puts a baking pan in the car with cookies on it, and it's so hot that, hey, it actually bakes the cookies. Well, in this case, something different happened. They did forget about their child in the car. Let's come down here and read why. Now, this didn't happen yesterday or the day before. It happened a few years ago. But let's read what happened here. Police ruled the death of this person that was left in the car. He was left in the car for 6 hours while the father was doing some work. Yeah, but here's why he forgot about them. Police ruled the death an accident. Tyler takes full responsibility. He explains he was experiencing brain fog after being hospitalized with COVID months earlier, and that day he was distracted by an audit at work. Mom Pamela said the family's usual morning routine had changed. Brain fog from COVID. I'm telling you, Even just, I mean, mind you, he was hospitalized, but there's people that don't even get hospitalized for COVID and that end up going on to develop long COVID and brain fog issues. This is really serious. And, bad things can happen from brain fog. In this case, a father left their child in the car and the child died. Such a sad story. All right, moving on to this. Just going to read a headline here. Clinical trials to begin for COVID-19 treatment developed in South Carolina. And if you read the full story, they actually say it's going to be something that you might be able to inhale, something like that. We've heard about this before, and I really hope it does continue. We do need an inhalable treatment for COVID. I think it would be fantastic. Want to read the full story? It is reposted on my X account, and I'll make sure I do get it to my website, datareport.info. All right, moving on to this now. We've been talking about Hawaii lately, and I thought I would show you this. Lee Altenberg posted, and this is right underneath the Hawaii's weekly update. So let's read the Hawaii update first. Daily average cases, 144. Reported deaths, just 3. Weekly positivity rate has rose in Hawaii to 14.7. Wow. Average hospitalizations, 96. And then he posts this underneath it. The COVID hospitalizations this week were higher than 76% of all days of the pandemic so far. And you can see here, just 7 weeks ago, they were at the lowest numbers in the whole pandemic. And take a look. They have rapidly rose. Now, there is kind of something good that could come out of this. Yes, it rapidly rose. It could also indicate that when it does start dropping, which may be soon, hopefully it will happen soon, maybe it will drop just as fast. That's the only good thing. It's not good to see the number of people going to the ER or hospitalized rise so quickly, because it means, well, a mass amount of people are getting infected all at once. All right, taking a look at what's going on in Ohio this week. And the weekly COVID-19 cases rise above the 1,000 mark again. This is their update for June 6, 2024. And the last time that they were above 1,000 was way back in early May. And here we are in early June now. So they did go up, and they did also see an increase in the number of people in the hospital as well. It says total reported hospitalizations are up by 34. That's number over the week. They don't actually do an active count. In other words, how many people are actively in the hospital at the moment for COVID? They just say how many new people were admitted into the hospital, and that results in 34. They also added 10 new deaths this week, and it says individuals with an updated vaccine went up as well. Another 1,960 people got that, and it says cases went up. 1,126 was the total reported case amount in Ohio. Alright, wasn't certain if I was going to show this or not, but yeah, here we are. I posted yesterday, time for one of my check-ins, basically asking, do you know anyone sick right now? Do you know anyone positive with COVID? Or are the ones sick? Did they actually test for COVID? And a lot of people said they did test. Several people said, hey, it's their first infection, or they know of someone who's sick right now, or their husband or a family member is sick. So clearly, there are people who know people who are sick and people who are sick with COVID right now. Speaking of that, let's take a look at what is going on in the UK with their weekly update. UK cases for COVID are down by 17.2%. 1,604 people tested positive. That's 333 less than last week. However, the rest of the numbers here did not update. We haven't had an update on hospitalization since April 28th, and at that point they were seeing a significant rise, but clearly with cases down, you have to assume the hospitalizations have now started dropping as well. All right, moving on now to the pollen levels, and we can see today's pollen levels, 45% of the country is in medium status, and there is some red today in Oregon. Anywhere who's in these orange areas or the red areas, you need to be taking your allergy medicine. Taking a look at air quality values, they're not good at all, especially across the eastern portion of the United States. You will see here we do have a lot of yellow and even some oranges still, but they are improving from where they were this morning. Why? Because there's a cold front that's coming through and making things better. Taking a look at Texas, air quality is pretty bad in South Texas, and the air quality is an issue across portions of the West Coast as well, especially in California. Heat-related illnesses, they do continue to rise, and let's refresh this here, because this does update once a week, but for some reason it's just not working at the moment. There we go. And we can see heat-related illnesses. The map is starting to fill in on the East Coast, and it's going to fill in even more in the Southwest and portions of Texas as the weather is getting hotter. Want to learn more about what is going on with climate and the weather? There are 2 ways you can do that. Yes, I'm saying 2 today. Because 1, you can follow my climate data report on X, just search for that in the search bar, or check out my other channel. I did actually do a post on my other channel today where I talk about weather. So you can go check that out. That is at Climate Data Report. Getting back to health here, 831 EMS calls were reported yesterday in Philadelphia, and I have been listening to the EMS calls today, and I can tell you so far today it has been a busy day. Taking a look what's going on in Montgomery County right now. Wow, 17 active calls at 6 o'clock in the evening. That is not a good thing, and we see just a general mix of everything. Cardiac arrest, stroke, breathing difficulty. I think I'm seeing more than 1 stroke here. Breathing difficulty again. So yes, there's a lot of things going on there. Taking a look at Chester County, not as busy. There are a few EMS standbys that are ongoing. And then we see respiratory difficulty, stroke, heart problems. So yeah, it's a busy day for EMS. Taking a look at Walgreens. The positivity rate this week is 22.9%. That is up 4.3% from the prior week's number of 18.6%. All right, let's take a look at wastewater. We've been doing this every day. Got to do it again today. Wastewater scan had an update today. Remember yesterday there was that sharp rise upward? Well, it updated to some more recent data as of June 2nd. Take a look here. The national wastewater. It went back down once again. So there was a little bump upward. Perhaps maybe that was caused by Memorial Day weekend. Now it went back down once again, which is good to see. And I did expect that there would be some sort of a correction because that rise upward that we saw going literally straight up yesterday, that didn't make much. It seemed like a bit of an overreaction, or if you want to call it that. It just seemed like it was overdone, and it did correct back down, and I think that's going to continue to be the case. Up, down, maybe no real clear trend. It may continue to trend upward, which I think it will. But the West Coast, West Coast is doing its thing. The Midwest is doing its thing. The Northeast is doing something different. It's not uniform across the United States right now. For example, Hawaii is seeing that rapid rise, while here in the East, at the moment, we're not seeing a rapid rise yet. We could, maybe down the line. We'll just have to watch and see what happens. All right, moving on to some CDC data here, and we haven't shown this in a few days. Epidemic status for COVID. It's growing in a lot of places, and it's likely growing in some places as well. We will get a full update on this again tomorrow. Taking a look now at the latest variants for COVID, which will update again next week, and a KP.2 variant leads the way at 28.5%. Then comes KP.3 at 12.7%. Today in New Jersey, and I'm going to refresh this, I'm pretty sure that is the up-to-date number, but I just want to check. Yes, 177 people in hospital. 7 hospitals did not report. 63 out of 70. 8 people on a ventilator. In the ICU, 22 people at this time. And discharges today, 27 discharges. New York State, it's Thursday. I do believe New York City does a weekly update now, which comes out on Thursdays. Someone correct me if I'm wrong about that down below. Either way, the cases are 1,038, which is higher than last week at this time. It could be because last week was a holiday week. That does tend to mess up the data. But when you look at the overall chart here, you can see here that it is starting to pick up the pace a little bit faster. What is not picking up the pace faster is the hospitalizations. 539 people in hospital today, although the number of people in the ICU did increase once again from 45 to 50. We'll have to keep an eye on that level. All right, moving on to another browser now. Why do we have to go to another browser? Well, because we have more data to take a look at. In LA, we do see that cases are rising today, and cases continue to rise in LA. And the positivity rate now is close to almost 4%. And we also see in LA that the hospitalizations, as of yet, are not rising too rapidly. Maybe people are having the viral load of a case. Maybe it's not so high. Or maybe it's just that this wave so far is not one of the more severe waves. We'll have to see what happens. And taking a look here what's going on with Connecticut. So far this week, 17 cases of influenza, 54 cases of COVID, 4 cases of RSV. It is important to note And you can see it clear as day. Let's take a look at last week's numbers. Last week, they had 87 cases of influenza. That was the full number. What we see for this week, that's not the complete number so far. Last week, they had 87 influenza cases, 313 COVID cases. Influenza, it can still happen at this time of year. But COVID happens much more common because COVID really has no season. I mean, there can be the winter wave, there can be the summer wave, but you can get COVID any time of year. You can with influenza as well, but you're more likely to get a case of COVID at any given time of the year, and you can see that here. 87 versus 313. RSV, not very likely at this time of year. 6 last week, just 4 cases. This week, taking a look what's going on in Massachusetts, 7.5% of emergency department visits are for acute respiratory disease. Influenza severity is low, as is COVID-19 hospital admissions, and emergency department visits for COVID in Massachusetts is minimal at this time. And finally, take a look at Washington. They did have a 33% increase in COVID emergency department visits in the state of Washington. Hospital admissions are up by 29%, and the average number of ICU beds occupied for COVID is down by 2 at this time. Alrighty, folks, that does it for the Thursday edition of the Pandemic Update. Hopefully you learned something in this video. We did learn today that H5N1, it continues to get more concerning as the virus itself seems to be getting smarter. It can now reinfect cows. Who thought it would go that route? I wasn't thinking about it. It didn't have it on my bingo card, but here we are. It's already learned how to reinfect an animal. Not a good thing. If you learned anything today, subscribe down below, give this a thumbs up, share these videos with anyone you know, hit that notification bell, helps the channel grow, and of course leave your comments down below. I will see you all again next time. Until I see you again next time, stay safe everyone, and have a fantastic Thursday evening. Thanks for watching.